of things except to just keep on being angry. So I'm saying it's not, but if we don't do anything, just keep on being angry, it's not getting milder with the time. The dichotomy gets larger and larger until you can't talk to the person. You know, it's just becomes, you can't speak to them. Now, when we are interacting with other people, I give it a term. It's called a horizontal engagement. Horizontal engagement means that my dichotomy reaches out, your dichotomy reaches out, and we're kind of mingling together. This is called horizontal dichotomy. This is what happened on the horizontal plane. We engage each other. This is called horizontal. But there are certain situations where the horizontal is actually a different kind of an engagement. I'm just looking for a name for it. What kind of name do you think I'll give it if it's not horizontal? Vertical engagement means that there is no push and pull anymore, but rather one is giving and the other is in taking mode. It's not giving and taking, but rather one is always giving, the other is always taking. This becomes a vertical relationship, meaning the mother and the baby, even though the mother is happy that the baby is here, but it's this kind of a relationship. Should be the father and son, just from a Chinese philosophical point of view, is this kind of a relationship. A teacher and a student is this kind of a relationship. A doctor and a patient is this kind of a relationship. It's not the doctor give me some money, I give him something, and we pull back and forth. How to do it, that's already a different story. Some relationship, the vertical relationship should happen naturally, but sometimes it doesn't happen. For example, the mother or the parents and the children should be in a very clear state of giving from this side to that side. But yet, sometimes you have people that cannot give to their kids and shout at them and beat them up and I don't know what. There's a problem. All of a sudden, it's actually like a vertical. You know, the daughter and mother, rah, 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 rah. It shouldn't happen, right? It should be, there's no shouting possible. But in this, it's possible, like fighting. So the question is, why is all of a sudden this situation become this, even when it shouldn't? You know, like we need to try to contemplate this. So far, the only answer that I can come up with is because the dichotomy is injured, or the warrior is injured, that this vertical relationship cannot take place. So the horizontal is taking over. And again, it could be because started in the childhood, started here, I don't know what, whatever reason, but this is the situation right now. Meaning the dichotomy is too large, what should be vertical can't happen. It has to stay horizontal engagement. So right now, at least in the specific roles that we're doing right now, you are the students and I'm the teacher. The jobs here is for me to give this way, your job is to take it. If tomorrow I'm sitting over there and you're lecturing, which is perfectly fine, my job will be to receive it, and whoever is here, the job is to give it. It's not like it's permanent. But meaning when this relationship is happen, this is what is the proper direction. It's not that the teacher standing here, it doesn't matter who the teacher is, me or someone else, and the students are giving to the teacher. This is improper direction. It's not about ego and this and that. There's something that is in a proper direction, and it's not a horizontal engagement. We're not pushing and pulling. I'm giving you, you giving me, back and forth, but rather I'm giving you, you're taking back, period. Not talking about the tuition fees or anything like that. That's what it should be. As a teacher, of course, if I am thinking about the tuition fees, it starts to be a problem. It goes in the horizontal. You know, I said, you know what, if they didn't pay enough, maybe I'm not going to say too much. No, seriously, there's some like this, I don't know, maybe not, but meaning my vertical is actually physically changed into a horizontal engagement. Like all of a sudden my calculations start to be somewhere else. It shouldn't be there at all. In other words, when I'm sitting with a patient, let's talk specifically with the patient, the only thing that could be in my mind and my heart is whatever is interacting here, there's only one question possible. And this is, how can I help you? So she is like, blah, 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 blah. And I said, how can I help you? I mean, not just artificially, like I feel it. The IVF doctor is this, that, this to me. So how can I help this? And I'm this and that, and my husband is doing this to this. But so what's happening in the heart? How can I help this situation? if at any given moment, and everybody fails on it, it's not like everybody is so great, but I'm saying when this happens, and sometimes happens to me too, like the patient pushed too much, the dichotomy too much, and I say like why am I, why are you, something, it just starts, the question. Immediately my vertical changed to horizontal, meaning she started to engage it. Even if I didn't complete the question, like, why are you bothering me? I didn't go the whole way. It was just the other why coming out. Already you developed this, you changed. It's called a horizontal engagement. But if she says whatever she says, I only feel like, how can I help that? It doesn't matter. The symptom with the herbs, how can I help that? The emotional, I'm crying, I'm this, how can I help that? This, in that relationship, is what we call vertical relationship. So this is naturally what's supposed to happen. But let's say you are just a shopkeeper, and I come to buy something, salad in your restaurant. This is not a vertical relationship. It is not proper for me to feel, how can I help you? It's not like I'm helping to the creations. Here it's proper to have a horizontal engagement. You want $5 for the Greek salad, there's not enough feta cheese. This is called a horizontal engagement. This is $4, it's fine, it's no problem. Like it could be proper. Of the cases, if not all of them really, you try to make a connection from center to center, which means I just want to try your life. I just want to try to help your life. I just want to help your life. That's what it means. But as soon as my dichotomy engages his or her dichotomy, this connection is already impossible. This is our difficulty. So sometimes, patient can express it, but not very often. Now and again, patient says, you should have put a diploma psychologist. What they meant to say, and they said, I don't know, when I come here I feel so good, but I'm not saying nice things. They just feel like someone doesn't want to take anything, even if they pay my fees. There's this feel that this is not what you're here for. And I'm not faking it. You can't fake this feel. Meaning, when she comes, you have to feel it. This is a vertical relationship. In order for me to do vertical connection, my own dichotomy has to be as small as possible. Now, it cannot be zero, because then I don't want to breathe anymore. But it needs to be as proper as possible, as small as possible. And this is very difficult, because all my life I cultivated center insecurity. And from my parents, from my brothers, from their friends, I don't know, whatever happened, my dichotomy always is larger like everybody else. It's not like I was born, what's his name, Zeus? Zeus? No, it's Zeus. Like everybody else, dichotomy large. Doctors are like everybody else. The same fighting, the same hating people, the same thing. The dichotomy is enlarged. And this prevents me from doing a proper doctor-patient relationship. It makes me a horizontal engagement, which is not the right engagement for this situation. So the question is now, how do I make my dichotomy proper or as small as possible in order to start to be able to make this connection, which is what should be done. Meaning this connection is normal for this. So the dichotomy is getting larger because my center is becoming weaker. Because my center is weaker, the dichotomy is larger. And therefore, when the dichotomy is larger, every time when there is an engagement, there's more emotion coming out. So on the most outside part of it, the recommendation will be, stop being so angry. And in reality, this is what normally, as I told you, I ask senior practitioners in China at the time, what should you do? If someone gets angry, you just tell them, stop being angry. But there's a problem with that. It doesn't work for sure, and sometimes it aggravates the situation, because the emotion is actually not where it starts. It starts in the basic dichotomy of likes and dislikes. The emotion becomes larger and smaller. So in other words, if my dichotomy was built up throughout all my life, built up, what we would call character, but it's not really character, is artificially constructed dichotomy from all the situation, and then there's emotion. Actually talking to the emotions on the end is very insignificant, because the problem is in the dichotomy and the center that feels weak. So when I give this recommendation, it's like I will tell the patient, stop being angry but I want more from you, which contradicts. Meaning, when you say it, not that it doesn't mean anything, but if your heart is taking, the dichotomy gets larger. That's why in the IVF clinic, when the doctor said, just relax, then the patient reports to me, since then they freak out. But he said, relax, why are you get more agitated, right? Like the opposite happens. The opposite happens. It's not like we are listening to what people tell us. It's the opposite happens. Or in other words, if my dichotomy is large, and that means I engage the patient horizontally, I cannot tell the patient to relax because I want from her. Doesn't matter what I say. I want from her. She cannot relax. She already has a problem with the center. I'm trying to pull out more. You cannot ask this. I mean, you can say whatever you want, but it's, what's the best word? Hypocritical. Like you say it, but actually your heart is not there. You want the opposite. So this kind of puts us in a very difficult place. That means that if my heart has a dichotomy, I actually can't give proper instruction to the patient. I can't teach the patient. I mean, I can say whatever I want, but I can't teach the patient. I can't have a vertical relationship. I'm forever engaging the patient horizontally. I mean, we're always in that thing, but my heart engages horizontally. My words saying doesn't mean anything. The only way that I can create a vertical relationship that truly can help the patient is if I make my dichotomy smaller. In other words, when the patient come over to me and enlarge her dichotomy, said, I want from you, right? She want to pull out from me. I actually don't feel it. This is called my dichotomy gets smaller. At this time, I can accomplish a vertical relationship. The patient doesn't know, she wants it. If I engage it, there cannot be vertical relationship. Only if I'm able not to engage it, she still wants it, but I'm giving her somewhere else. And in fact, in that time, words are not really needed. Meaning the connection that you make with the patient doesn't think about it. She just feels very comfortable. Meaning she wants to take from you. Normally people want to pull back and do an engagement. She wants now to take from you, and all of a sudden it becomes effortless for her, or for him, for the patient. Like she wants to pull, and it feels like she's pulling, but there's no pullback. That's why the person with the large dichotomy starts feeling very comfortable. Right? Nobody wants to take away, but like think about it. You don't have money, and she has a lot of money. So let's say I'm pulling from her money, and she doesn't care. So I'm pulling. There couldn't be anything uncomfortable. I want money, she has money, she gives me the money, there's no conflict. Just when she said, look, it's mine, meaning she's pulling back, that's when we start the conflict. This is called horizontal. So again, if the patient engages me, and they all do, at first at least, you have to be aware and train the dichotomy in order not to engage it, in order to be able to make a connection. And the patient, like, how do you know that it happened? The patient just feels very happy, meaning very comfortable. Even if I tell her, stop talking. Yeah, really? Yeah, meaning if you can make this connection. But I can also say with the horizontal engagement, shut up. The patient immediately feels offended. You know, stop talking. It's not about the words. It's like rather where you connect. If she feel that I'm pulling back, that's why I'm telling her stop, she's gonna feel very upset, like very uncomfortable. I'm paying you, I'm this, all kind of thoughts coming. But if you do it like from a different place, for a good reason, because I want to help you, and of course the tone will be different, the voice will be different, effort will come out different. Person, sure, and then you talk to her and it makes sense, and you know, it's like you don't shut her up, even if you say stop talking. For example, normally I don't say stop talking. They talk, it's good. I just close my eyes, go to sleep. It doesn't matter.